Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. From your health and safety to positive outcomes, there is a lot at stake when you choose plastic surgery. And choosing a qualified surgeon can be the first step to getting the results that you want. And this hour on plastic and cosmetic surgery will give you the tips of what you need to know to find the right doctor. And joining us to talk about this today is Dr. Daniel Careaga, a plastic surgeon with Careaga Plastic Surgery at Baptist Health South Florida. Welcome back to the show, doctor. It's great to have you.
Thank you so much, Kathy.
Now, as we get into some helpful tips, I do want to start off with an overview of what it is that you do. So you've performed nearly 10,000, is this true? 10,000 procedures?
About 8,000, a little over 8,000 procedures.
Okay, still a big chunk, a big nice number. So what type of procedures are we talking about?
So my practice is dedicated exclusively to aesthetic surgery. So it's about a third of it is body contouring, mostly tummy tuck, another third about liposuction-based procedures, and about a third breast surgery. So I do a lot of breast and body contouring and facial rejuvenation as well.
You're also double certified. So for our viewers at home, what does having a double certification mean?
So board certification is a voluntary step that doctors can take after they've completed their training. So you go through your years of training, and then there are exams that you have to take. And in the case of surgery and plastic surgery, it consists of 2 exams for each one. One is a written exam, and then one is an oral exam. And in plastic surgery, it's really one of the most stringent board certifications to take, because you actually have to take them all of your work and show them what you've done, and they quiz you on it, they grill you on it. It's a very grueling experience.
So it's very intense.
Absolutely, it's very intense. Not all physicians are board certified. When you are looking for a plastic surgeon, it really is the minimum that you should require of your surgeon, because it is the only way you have of really knowing that the person that you're going to be trusting to do your surgery really has the training and experience necessary to complete it successfully.
So this double certification, not all surgeons have it.
Correct. Yeah. No, not everybody has double board certification. Only about 1% of physicians in the U.S. have double board certification.
So what mandatory accreditations are needed for a plastic surgery?
So for plastic surgery, you have to have completed a plastic surgery residency, and usually that can be anywhere from 6 to 8 years of post-training after medical school. Now, the issue comes in that there is no requirements put on by the state as to who can practice aesthetic surgery, well, cosmetic surgery. So there is a lot of what we call non-core providers, which are physicians that are non-plastic surgeons, doing the same operations that I and my fellow plastic surgeons are trained to do. And these are people that never received any formal training, because the only way in the United States to receive formal training on plastic surgery and aesthetic surgery is to have completed a plastic surgery residency.
So would that be a red flag?
It is a huge red flag, because a lot of these cosmetic surgeons, what they do is they literally go and take a weekend course on how to do liposuction, or a week-long course on how to do a breast augmentation, and then start doing it. And you can't expect that they're going to have good outcomes by that kind of method.
And that is terrifying. Are you often finding that you have to do a lot of corrective surgeries as well?
I unfortunately do, especially here in South Florida, because in South Florida we do have a preponderance of these cosmetic surgeons, and I'm talking about gynecologists, anesthesiologists, even internists that are performing cosmetic surgical procedures. And then we also have a gateway, since we are the gateway to Latin America, we also have a lot of patients that live here and undergo surgical tourism, so they'll go to other countries. So the Dominican Republic is very popular, Colombia is very popular, Venezuela used to be very popular, not so much right now, obviously. And there have been, obviously a lot of issues. There's, of course, amazing surgeons in these countries. Colombia is known for its plastic surgeons. But when you are not a resident of that country, sometimes, especially if you're not connected, if you don't have family there, if you don't know how to determine...
You're going in blind.
Exactly. So you're just going based off a website and some before and after pictures, and that's really not the safest way to find your surgeon. And the Dominican Republic has also had a very high-profile article that came out a few weeks ago on infections after cosmetic surgery procedures. And there's a specific bacteria that hadn't really ever been a source of infections in plastic surgery, and there's been like a rash of them there over the last couple of years. It's a mycobacterial infection. We never really see that as an infection.
And that's something that someone from the U.S. may not be familiar with at all.
Absolutely.
Wow. Okay, so now what constitutes a good doctor?
So a good doctor is performing what they were trained to do, okay? Because ultimately, your most important thing is to take great care of your patients. And that starts with their overall health, and then of course with the quality of the result that you can give them. So if you are performing procedures that you were not trained to do, that is a disservice to your patient. So when you come in for a consultation, the most important thing is developing your level of comfort with that doctor, because you're going to trust your life to their hands.
Absolutely.
So it starts really at home. You know, patients really need to do their research. And nowadays we have a lot more available to us online than we did, say, 15 or 20 years ago. I mean,
and now there's social media where
absolutely.
These pictures, the before and afters you talk about as well.
Absolutely. So the internet and technology has really empowered patients to choose the right physician. So they can easily look up if they are truly board certified in plastic surgery. They can look up if they've had any claims against their license. They can look up their malpractice history. They can look up the overall trend of their reviews, their before and after pictures. So we really live in a very empowered age, and patients really should do their due diligence. And then once they've chosen 2, maybe 3 surgeons, then they go for the consultation, and that's an interview. They're basically trying to figure out if this doctor has what it takes to give me my result and I can trust my life with.
Absolutely. Now we're going to talk more about this, but I do want to take a moment to let our viewers know you can call in if you have a question. The toll-free number is 855-796-4475. We'd love to hear from you. Now, if someone is looking for a new doctor, what should they be looking for? You're saying that it starts at home, they're doing their research. Once you narrow down to those 3 doctors, you said a consultation is very important.
Correct. So the consultation should start with, saying hello, introducing himself, and then taking a history, trying to determine what are the patient's goals, what are their desires, making sure that their expectations are realistic, because a lot of times patients don't necessarily have a realistic expectation as to what plastic surgery can accomplish.
Can we talk about that? Because I am sure you get some patients that come in, they'll bring you a photo of a specific celebrity and say, this is what I want. And you have to have a very honest and genuine conversation with the patient.
Absolutely, because it is all about managing expectations. So I want my patient's expectations to be realistic with what I can deliver in the operating room. So if I have somebody that has had 3 or 4 children in her 50s and her breasts have come way down, and she brings me a picture of a 20-year-old with perfect breasts, that's not realistic. I cannot, nor can any other plastic surgeon ever deliver that kind of result, because we're dealing with skin that has now aged. And as we age, skin loses its elasticity, the collagen fibers get weaker. So we do a lift, but it's never going to look like that when it was 20. So managing expectations and making sure your patient understands that is key, because you really don't want to operate on somebody that doesn't understand what is realistic as to their result. Absolutely. You also want to make sure that they understand all the risks of the surgery, because this is surgery and all surgeries carry risks. So the doctor really should be explaining what are the potential problems that could potentially go wrong.
And you're also, as a doctor, you expect certain questions that a patient might have. Is there certain questions that a patient comes to you and it's sort of expected when they come in for a consultation? What are they really looking for? So
patients want to know what is going to happen step by step. So from the day of the consultation to they're fully recovered, and I explain to them. So it starts out with, once they decide that they want to book surgery, they'll come in for a pre-op appointment, and that's where we'll do the blood work, EKG. They'll sign their consent forms. We'll get everything ready. They'll get their instructions and prescriptions for the day of surgery. Then, of course, the day of surgery, they want to know how their operation is going to go, how long is it going to take, who's going to be doing their anesthesia, what type of anesthesia is it going to be, how long will they be in recovery room. These are very common questions that I get asked. And then, of course, a very important question is, how is going to be the recovery like? Is it going to be a difficult recovery? Am I going to be in pain?
How quickly can I get back to life?
How fast can I go back to work? When can I go back to the gym? When can I have sexual relations with my partner? So these are really the common questions that patients want to know. So the consultation really is the time to ask all those questions, if the surgeon hasn't already answered them, because most of the time, I understand what my patients' most commonly asked questions are, so I always include that. Exactly, I always include that in my talk before I let them ask any questions.
What about the facilities, doctor? Often you see a lot of these plastic surgery locations have almost a standalone facility. Others do the surgeries at a hospital. Is that something to be wary of, or?
So really you should ask for an accredited facility. And there is a big difference because we were talking about board certification for physicians.
Right.
And that is great. It is very important to have board certification. But for an operating room, there is a difference between certification and accreditation. So certification is what the Department of Health for the state of Florida gives an operating room that makes it legal for that operating room to perform surgery.
Right.
But it is the bare minimum of what that operating room needs to perform surgery. So much so that I don't feel it's truly adequate. So you should really seek out an accredited facility. And accreditation is completely voluntary. It is just like an accreditation for a school.
Right.
You know, schools don't have to develop accreditation, but it's to show that they have a level of commitment to excellence that they want their family members, their patients, their students and their families
right.
to be aware of. And it's the same thing for accredited surgical facilities.
So that facility is equipped with more equipment, more access to,
correct.
Let's say the same thing as an operating room in a hospital.
The equipment, the medications, the training of the employees, the personnel involved is held to a much higher level of standard than what the Department of Health holds the operating rooms. So that way you know that you're going to a surgery center that has everything necessary in the event of any sort of adverse outcome.
That's great feedback. Now up next, we will get a look at the latest trends and what to expect out of a consultation. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
Worried about keeping your brain sharp as you age? Studies show that these 4 steps may help. Stay physically active. Strive for 2.5 hours of moderate exercise weekly. Reduce vascular risk factors like high blood pressure and cholesterol with good diet, adequate sleep, and medication when necessary. Talk to your doctor about diseases and drugs that may impair brain function, and keep your brain lively with social and intellectual pursuits. For more information, visit dana.org.
Hi, I'm Janelle Hale, founder and CEO of the National Breast Cancer Foundation. No one should face breast cancer alone. When I was diagnosed 36 years ago, there was no internet, and I had to make a decision with little information. Early detection saved my life. It could save yours too. To learn what every woman needs to know about breast cancer, visit nbcf.org/hope.
Us lives here, where we can be surprised by others and ourselves. For a better us, support your local Y today.
Wonder if you should get tested for colorectal cancer?
Is it really that common?
It is. It's the second leading cancer killer in the U.S.
I don't have symptoms.
It doesn't always cause symptoms, especially early on. And screening helps prevent the disease.
Oh? How?
By finding precancerous polyps so they can be removed.
But that test.
There's more than one screening test. If you're 50 or older, talk to your doctor about which one is right for you. Colorectal cancer screening really does save lives.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer. Enter your family history, learn your risk, talk to your doctor. Visit nobraca.org to find out more.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Daniel Careaga, a plastic surgeon with Careaga Plastic Surgery at Baptist Health South Florida. If you have a question, give us a call. That number's 855-796-4475. Now, according to the American Society of Plastic Surgery, the top cosmetic procedures have been on the rise the last 5 years. Now, this goes for both invasive and non-invasive procedures. So, doctor, can you explain the difference between non-invasive and invasive?
So invasive is basically surgery, okay? Invasive procedures are liposuction, breast augmentation, facelifts, tummy tucks. They are operations that have to be undertaken by a plastic surgeon and like we talked about, an accredited surgical facility. Non-invasive procedures are things such as fillers, skincare treatments, and now there's, with the development of better technology, we're able to offer patients results for body contouring, for facial rejuvenation without necessarily having to go through surgery. So for instance, there's a device called sculpture. Sculpture is a laser that penetrates the skin to a depth of about 2 centimeters, so almost an inch, and it reduces about 25% of the fat volume in that area that you're treating.
Ooh, I love that sound.
And then I have now the newest device. It is the first and only device approved by the FDA. It's called M-Sculpt, and it's the FDA approved for building muscle mass. So basically it is an electromagnetic pulse that you put over the abdominal muscles, and it creates a hypermaximal muscle contraction.
So I can come in and get abs at your office?
Exactly. So it's one session is the equivalent of doing 20,000 abdominal crunches.
Oh my goodness.
So the results are really impressive.
Right.
So, and I think that that is a trend that is going to continue as the technology gets better.
Right.
You know, so we're not at the point where technology is replacing surgery, but it's definitely enhancing it, because a lot of my patients would come in and say, oh, I want to do the abdominal etching, I want the high definition liposculpture, I want to see my abs. And I've never liked that operation, because what you're doing is you are demarcating the abdominal muscles, but you're leaving a little layer of fat over them so that it looks like you have a six-pack, when in really you don't. You just have a little bit of more fat over the muscles, and the lines have been sort of better etched.
Right.
The issue with that operation is that over a few years, it has a tendency to look a little weird, you know, especially if the patient gains a couple of pounds.
Your body changes.
Exactly. I've done a lot of corrections on patients who have had that done at other centers, and you can see how it changes with the aging of the body. So now I'm able to offer patients this form of, really it's more of a true high definition liposuction. So I do a thorough liposuction, remove all of the abdominal fat, and then with the M-Sculpt, we can really augment the muscle mass of the abdominal muscles. So you really have a true six-pack. So you can really see the abdominal muscles, not just a fake show.
And this is an incredible procedure, and we're actually going to dedicate a whole segment just to M-Sculpt. So I want to get into the surgical procedures from 2017 and why these were so popular. And I want to ask if you saw the same in your office. Number one being breast augmentation.
Absolutely. Absolutely. Breast augmentation, liposuction, and tummy tucks are my 3 top operations.
Okay. And we see as well nose resation, eyelid surgery. Can you talk a little bit about that one?
So eyelid rejuvenation is very important. It's always been very, very popular. So people don't like to look in the mirror and see, you know, excess skin over their eyelids. Women have trouble putting on makeup when they have the excess skin over their eyelids. So eyelid rejuvenation can really make a huge difference in the perceived facial age. If it's done well, it can look very natural. It does not change the shape of your eye. It basically just rejuvenates it. It takes back that excess skin that is common to develop over time, usually starting in your 40s. 50s.
Let me ask you, doctor, sometimes you may have a patient that might come in for a breast augmentation and maybe that tummy tuck at the same time, or liposuction. Is that normal to see multiple procedures done at once?
It is absolutely normal. So combination procedures can be done safely, but the decision to do a combination procedure really is on a case-by-case basis. So obviously, patients would like to do as much as possible in one operation because it is a quicker recovery, it's less downtime, less time off of work. However, it really is based on safety. So there's factors that I look into when I'm going to decide if I'm going to combine procedures or not. So one of them, of course, is the patient's overall health. Okay, they have to be very healthy. They can't really have any medical issues.
Right.
If I'm going to combine procedures, their age, their weight,
Their lifestyle.
any history of smoking, the length of the procedures, how much time I think each procedure is going to take me. So procedures can be safely combined on is individual patient
Right.
based on these issues.
Absolutely. Now, we also have some examples of the top non-invasive procedures. So are you noticing similar trends with your patients?
Absolutely. So Botox still remains the #1 cosmetic treatment worldwide. Millions of patients get Botox every year. It is an amazing treatment. It is still the gold standard for facial rejuvenation for eyelids, for the forehead, for the brow area. There is really no good surgical treatment of crow's feet. Yeah, when you
Right.
think about that, so up until we developed Botox about 20 years ago, there was no treatment for crow's feet, and now we can get rid of crow's feet.
That's amazing. And soft tissue fillers, these are the fillers you were talking about, the ones that go in your cheekbone, maybe your jawline.
Absolutely. So what we have come to realize as plastic surgeons over the last 20, 30 years, that aging is not just gravity pulling skin down. So part of it is loss of volume. So starting in your 30s, you actually start to lose soft tissue volume. So soft tissue is essentially the fat of your face.
Okay.
And even in your 40s, you start to lose bone volume. So if you were to look at an X-ray from a 20-year-old and then take the same X-ray on the same person when they're 70, you would actually notice on the X-ray that the orbits, so the bony structure where the eye lives,
Become hollow?
become bigger because they lose bone mass. So now we have great fillers that can augment the soft tissue volume and augment even the bone volume. So reestablishing that volume is a very important part of facial rejuvenation. It's not just lifting and pulling back skin. We have to gently and naturally lift and pull back skin, but we also have to fill the volume loss. And 30 years ago, when all we had was a facelift, if you wanted facial rejuvenation, you really didn't have a choice. It's just go in and pull. And that's where it led to a lot of these over-pulled looks. Because
Right.
if you only have one treatment option, it's
And it really not is a one-size-fits-all.
Absolutely
and
not.
so this was happening with the facelift. So you kind of beat me to my next question, which is, you've seen a lot of the changes that have occurred in this industry. When you talk about past treatments to now, what do you see and what has changed?
I think plastic surgery has really, and for the better, taken a more natural route. I think that in the 80s and 90s, we had a tendency to have sort of these overpulled facelifts. We also had a tendency for very, very, very large breasts, so that was sort of sparked by the Pamela Anderson generation. I have personally in my practice seen my average implant size go down for breast augmentations. So probably when I first started in practice, my average implant size was probably about 400 cc's, and I would say now it's probably closer to about 300 cc's. So the trend has definitely gone to more natural lifted proportions, which is a very good thing because, for instance, large breast implants can lead to big complications over time. The breast tissue can thin out, the breast can droop. So fortunately, the plastic surgery as a whole has really shifted to more of a natural results driven.
You and I were talking about this off camera, and it kind of ties into what we're talking about, that open communication between a doctor and a patient. But when a patient comes in wanting something that it's not going to work, it's too much, what do you do in that case?
I tell them no. I mean, a good plastic surgeon has to be able to say one of the most important words in the English language, which is no.
Okay.
And it has to do with managing the expectations. There are patients that don't understand, what it is that we can truly deliver. There are patients that have a condition called body dysmorphic disorder, which can lead them to see things that aren't really there. And it really behooves a good plastic surgeon to try and diagnose those patients and refer them to see somebody, a therapist, a psychologist, or even a psychiatrist, because they are not going to get any improvement in their psychological issues with plastic surgery. Plastic surgery can do amazing things for your...
But you have to want it for the right reasons.
Exactly. It is to reestablish self-confidence. So a patient has lost some self-confidence, whether it's due to something that they were born with, whether it's due to aging, whether it's due to childbirth, and we are there to give patients their self-confidence back. But we're not there to fix a psychological problem that has really no basis in on their physical appearance.
Absolutely. Now, figuring out why you want a procedure is something worth considering before plastic surgery. And we have a few more tips that Dr. Careaga can talk about. Why am I doing this? Kind of ties in exactly to what you were saying. What are your reasons for having cosmetic surgery?
Right, and I want to know that from all of my patients. Number one, I want to make sure it is strictly for them, because I do occasionally get patients that say, oh, well, I like my breasts, but my husband or boyfriend wants them bigger. I'm like, well, then I'll do his. But, you know,
not a good reason.
Right, that is not a good reason. Right. You want to know that the patient's doing it for themselves, that they understand the procedure, what it entails, what is their potential result, what they want to change. You want to make sure that the deformity that they see goes with what I see.
Right.
Okay, and that they're not focusing on something that, you know, if a patient's telling me, you know, comes in and says my breasts are like by my knees, and they take their shirt off and it looks perfect, you know, they're perky,
right.
You know, they are seeing something that's not truly there. And then, of course, we talked about the managing of expectations. You know, I want to make sure that their expectations are in line with what I can deliver.
Absolutely. Now, imagine getting the results of a workout without working out. We will talk about a new non-invasive treatment used to tone muscles while you sit back and relax. You're watching the Health Channel. All health, all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. Don't go anywhere.
C stands for cutting edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for Cure. World-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Us. It's what this country is made of. But right now, our bond is framed. How do we get back to us? The why fills the gaps and bridges our divides. Support your local why today. Because where there's a why, there's an us.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Daniel Careaga, a plastic surgeon with Careaga Plastic Surgery at Baptist Health South Florida. If you have a health question, give us a call. The toll-free number is 855-796-4475. Cosmetic procedures for body contouring aim to improve appearances and muscle, skin, and toning. And some procedures require surgery, but others are non-invasive, like the M-Sculpt, which sounds like a miracle from God. So could you give us an overview of what M-Sculpt is and what it does?
So as we mentioned earlier, M-Sculpt is the first FDA-approved device that actually augments muscle mass. It builds up muscle. So it's essentially a very, very big magnet. It's placed on the abdomen, and that creates what's called a supramaximal muscle contraction. So it essentially causes the muscles to contract in a way that no person could ever do on their own in the gym. So,
like 20,000 abs, crunches,
right. So
you said.
one session has been shown to be the equivalent of about doing 20,000 abdominal crunches. The treatment sessions, it's usually grouped in about 4 sessions over 2 weeks. That's about half an hour each session. It's not a painful procedure, and I can tell you because I have had it and I've seen the result. It feels weird. It's really the best way to describe it. It feels like a cool electric stimulation, but it's not an uncomfortable procedure.
That just means it's working.
Right, exactly.
Yes.
And you can actually see the device coming off of your muscles because they're contracting so hard. Studies were done on MRIs, so patients underwent MRIs before and after the series of 4 treatments, and the volume of the thickness of the abdominal muscles was measured, and it was found to be a 16% increase, which is significant.
Wow. Now, what happens to the fat?
So the fat also was shown to decrease in 19%, so by 19%. So it also gets a fat reduction, but the primary goal of the treatment is building up the muscle. So
there are so many treatments out there in terms of sculpting the body. So how is this one different from one that, say, freezes fat?
So the freezing of the fat is a good, effective treatment just to remove some fat from a localized area, but it does nothing to the abdominal wall. It doesn't do anything to the muscle thickness. It won't really do anything to enhance the appearance of the muscles. M-Sculpt, as I mentioned, is the only FDA-approved device to build up muscle. Not only that, it's been shown also to improve the diastasis in women after childbirth.
Wait, stop, because I have diastasis right now.
So diastasis, as I'm sure you're aware, is a separation in the abdominal muscles. So the abdominal muscles are 4 pairs of muscles, and they're held together in the midline through a thin layer of connective tissue called the linea alba, which is just the white line. That thin layer of connective tissue stretches during a pregnancy to accommodate the growing uterus. And in many patients, everything shrinks back down afterwards, but also in many patients, it stays stretched out. So you end up with a little pooch. You have a little bit of bulging, muscle bulging.
Oh, I know that well. Yes.
And when it's significant, really the only true treatment option is a tummy tuck with muscle reconstruction. However, if it's a mild diastasis, we can actually see a very nice improvement with M-Sculpt because by tightening up, building up the abs on either side, it actually sort of pulls that connective tissue so that you don't see as much of a bulge.
So it is safe for someone that has hernia or diastasis to use?
Yes, for diastasis. For diastasis. If you have a large hernia, then no, that is a contraindication for the procedure.
Okay, this is fascinating. So you are actually 1 out of 2 facilities that carries M-Sculpt and does M-Sculpt, correct?
Yes, correct.
Do a lot of patients know about this yet?
It's new technology. The word is getting out. The company is doing a very effective job at educating the public. And of course, we have done a lot as well. But it is new technology. And I think that in 3 or 4 years, we're going to be hearing about it the same as cool sculpting, where it has word of mouth and patients come in requesting it.
So doctor, walk us through a patient comes in your office, is interested in M-Sculpt. What does the procedure look like? How does it feel again? And how do you decide if that person is a good candidate for the procedure?
So a good candidate for the procedure is somebody that is fairly close to their ideal body weight, because if you're 30 or 40 pounds overweight, you're not going to really see a difference whether or not your abs are 16% bigger or not. So it really is for somebody that has gotten to their close to their ideal body weight, whether through diet, exercise, or even surgery, because like I mentioned earlier, it also is a very useful supplement to liposuction.
Absolutely.
It's somebody that doesn't have a large hernia, because that is, of course, a contraindication. Ideally, it's somebody that goes to the gym, because this obviously does not replace the gym. Working out is still very important.
Right.
But it definitely supplements it. It's going to enhance it in a way that would be very difficult for somebody to do at the gym on their own.
It's some nice help.
Absolutely.
Right, we can all use that. Now we're going to talk more about this, but I do want to take a moment to remind our viewers you can call in if you have a question for Dr. Careaga. The number is 855-796-4475, and we're standing by and love to hear from you. So if the Emsculpt session feels like a workout, I'm interested in the results. So what is the workout equivalent if you are doing the Emsculpt? As you said, it doesn't take the place of a complete workout.
Correct.
But it does help.
It does help, especially for the abs and also for the glutes. The FDA approval is both for abdomen and also for the gluteus muscle, which of course is the butt. So the improvement in the butt is an improved contour, and it can actually lift a little bit the butt.
So it's abs and your glutes.
Correct.
That's it. No other part of the body.
Not yet. They are
Not
working
yet.
on different applications. So they're working on the FDA approval for arms and also the chest, the pec major. But those are still not available.
So you said it works with 4 sessions, but what will a patient feel after just one?
So probably feel a little soreness, as if you would have done an abdominal workout. The device has a mode built into the treatment that actually pushes the lactic acid out of the muscles, so you don't get that intense burn that sometimes you get, like for instance, if you haven't worked out in a year or so, and all of a sudden you just go back and do a very intense workout. So it's actually not an unpleasant treatment. The treatment itself is not painful. Like I mentioned earlier, it just feels a little weird. It feels it's an odd sensation. It's something similar between a muscle contraction and a little bit of an electrical stimulus, but it's very well tolerated. I've never had somebody tell me that they can't tolerate the procedure or that it was painful. And then you might have a little bit of soreness, the next day, but it's not bad at all. The sessions are done about every 2 or 3 days over a period of 2 weeks.
And downtime?
No downtime at all.
At
you
all.
can go to the gym the same day. You can do anything you want.
Someone could even come in during their lunch break and get
Absolutely.
it done. It's incredible. Now, is there any way patients have to prepare for this procedure before they come in, or?
No, there's absolutely nothing that a patient needs to do. They need to be evaluated by myself or by Rihanna, my PA, to make sure that they don't have a large hernia and that they are a good candidate. And make sure, again, sort of the overall theme of this has been managing expectations with possible results. We want to make sure that it's somebody that is going to see a benefit, because we don't want patients doing it that aren't going to see the improvement.
Absolutely. But this doesn't necessarily take place, let's say, another procedure like a tummy tuck or liposuction. It's different?
No, it's different. It will never replace a tummy tuck or a liposuction. So for patients that have moderate to severe diastasis, really the tummy tuck is and will be for a long foreseeable time the only treatment to improve the muscle tone of those patients. And same thing for liposuction. If you have somebody that has 20, 30 pounds overweight, that they have, an inch and a half of fat between their skin and their muscles, liposuction is still really going to be their best option for contouring.
And we're seeing body contouring on the rise, Doctor. Can you talk a little bit about what other procedures in your practice you often see?
So it's a toss-up between liposuction and liposuction with fat transfer to the buttocks.
Okay.
So buttock enhancement, of course, is very big. It's very important. We live, of course, in paradise. We live where everybody else vacations, and
where everybody's almost naked all the time.
That's right.
Yes.
And for that reason, Miami is essentially the mecca of plastic surgery, and a lot of it has to do around the abdomen, the waist, and the butt. Patients like to have a flat abdomen, a very tight waist, and a curvaceous butt. So fat transfers to the buttocks. It's a controversial procedure right now, but it's a procedure that can be performed safely in the hands of a board-certified plastic surgeon.
What about the difference between procedures for men and women? Do you often see that your male patients have certain requests as to what they want compared to women? So
my male patients, the most common operations I do are liposuction, eyelids, and gynecomastia. Gynecomastia is essentially what we call man boobs. It's the development of abnormal breast tissue in a man, and it's usually a combination of breast tissue and fat. And then, of course, that can be very embarrassing for men, especially if they're going to the beach. A lot of these people that have gynecomastia, they won't want to take their shirt off because they're just very self-conscious about it. So it can really make a huge difference on a man's self-esteem. And we're talking about South Florida, we're talking about men and women, and one of the things that obviously happens here when you live in paradise and sunny weather is that you sweat a lot. And I understand that now many patients come in and have a procedure or even fillers, correct,
to stop the sweat glands? Is this true?
There are multiple options for stopping sweat, what we call hyperhidrosis, which is an abnormal amount of sweat. I mean, everybody sweats, it's inevitable. But there are patients that have an excessive amount of sweat that can be very, very embarrassing. There are treatments, and that ranges from Botox, which is the least invasive, and Botox into the axilla or underneath your arm can stop the sweating for a period of about 6 months. There is a procedure called Miradry, which is a little bit more invasive, and you numb up the tissue, you numb up all the tissue of the underarm, and then it's an applicator that's placed on the underarm, and it's microwave energy, and it sort of cooks the sweat glands. So that's it. They just sort of scar down, and they don't work anymore. And then the same procedure can be done called Precision TX, and it's a minimally invasive laser fiber. So I make a very small incision and go in and essentially, again, destroy the sweat glands to make it very difficult for them to produce the sweat.
So many procedures out there now. There's options for everything. I want to go back to something you did talk about, which was a little bit about the butt implants. Is that something that you see as well here? So
butt implants are, again, another controversial procedure. Not a lot of surgeons are doing them anymore because they have such a high complication rate. Probably about 30% of butt implants will have to be removed for one reason or another. Usually it's infection or bleeding or malposition, moving around. So not a lot of people are doing it anymore, especially because the fat transfers have become so mainstream, and it's very unusual that we have a patient that doesn't have enough fat to really give them a more curvaceous bottom. So butt implants are not the best procedure.
And sounds like something you don't recommend.
No, I really don't.
Okay, thank you for that, doctor. Now we will talk about how healthy lifestyle compare well with results from cosmetic procedures coming up next. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
Cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
I lost weight without trying. Bleeding. I gained weight, and I didn't know why. Pain. Really tired and weak. Pencil-like stools.
A sudden change in bowel habits.
My dad was diagnosed with colon cancer. There's a personal history of polyps.
Family members had polyps.
My husband wasn't 50, but something wasn't right with his body.
I have Lynch syndrome.
I turned 50.
If the doctor has said it's time.
My family members are turning 45.
I don't have any signs or symptoms, but I am turning 50 soon.
So when it comes to colorectal cancer screening, don't assume that you don't need to be screened.
There are many affordable take-home options. To learn more, go to fightcrc.org.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with, it's different from a man and from a child. So there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
Welcome back to the Health Channel, All Health, All the Time. I'm Kathy Buccio. With me is Dr. Daniel Careaga, a plastic surgeon with Careaga Plastic Surgery at Baptist Health, South Florida. I want to remind our viewers to call if you have a question. That number is 855-796-4475. Now this hour, we've been talking about a number of procedures, some more invasive than others. So when it comes to the downtime from procedures, I know that's one of the big questions you get from patients. What should they expect?
It really all is determined by what procedure they're having done. So if it's like a non-invasive procedure like M-Sculpt, I mean, there is no downtime at all. They can work out the same day, work the same day, whatever they need. Procedures that are minimally invasive, such as smaller areas of smart lipo, or even breast augmentation, and usually it's a weekend recovery. I mean, most of my patients with breast augmentation, they can go back to work in about 3 or 4 days.
Wow. With
restrictions that they can't lift anything, over about 10 pounds for 2 weeks.
Mm-hmm.
Larger, more invasive procedures such as tummy tucks, facelifts, those we generally require anywhere from 10 to 14 days to be fully recovered to the point where they can sort of drive and go back to work and feel comfortable going out into society.
But a weekend and even a week, that's impressive.
Mm-hmm.
And so you actually tell your patients, I know a big question here is exercise as well. That is more of a couple weeks, correct?
Right, and again, it also depends on the procedure. So for breast surgery and even for tummy tucks, I recommend just 1 month, absolutely no gym whatsoever. And then at a month, start out with low impact cardio. So things like elliptical, bicycle, treadmill on an incline, Stairmaster, things that aren't going to cause a lot of bouncing.
Okay.
And some light leg weights for breast surgery. If it was a tummy tuck, they can do some light arm weights. And really at 2 months is when I let people really start getting back to their old routine. With the exception that for tummy tucks, I don't let them do any abdominal exercises for 6 months.
For 6 months?
Yeah, it would be very uncomfortable for them because the suture that I use to tie those muscles together is permanent. That's going to be there forever. You want that there forever because you don't want those muscles to separate again. But if you're going to start doing abs, that muscle is going to pull against that suture and it can cause a pretty uncomfortable cramp. It probably won't hurt anything, won't cause any damage, but it can be uncomfortable. So I tell people 6 months and until all the cramping is gone.
Is there anything else you do for a patient pre or post recovery to prepare them for surgery and then after for recovery?
So the important things are the patient needs to have that time off of work. They really need a good support system in place to help them with their recovery. So family members, trusted friends, or for instance, if we're having out-of-town patients, and we do get a lot of out-of-town patients, we have a nurse that can stay with the patient. So the patient needs to have somebody that can take care of them during those days right after surgery. So help them go to the bathroom, help them eat, help them get to their appointments. And it's really just setting the patient up for a successful recovery.
Absolutely. Now, part of maintaining a healthy lifestyle is eating healthy. And earlier, we had a registered dietitian go through today's healthiest trendy diets.
And since we're talking really more today about the healthiest diets and balanced, and I wanted to look at what's listed as the best overall diets. And this is again according to the US News. The #1 diet is the Mediterranean diet. And I would like to learn a little bit more about each of these from you, Lisette, if you can talk to us about what each of these are.
Sure, we can start going through them briefly. So Mediterranean is an eating pattern. So if you try to go and find the Mediterranean diet, there's not an exact diet. It's more about a pattern and a way of eating and also a lifestyle. So it includes more of your fruits, your veggies, your whole grains, your legumes, nuts and seeds, and less animal products, less dairy. Dairy is still present, but it's just maybe not, those massive pizzas, or, just less amounts. Less of the animal fats through, eating less of the animal protein. So you're having more olive oil, for example. So Mediterranean is also a lifestyle, so there's more movement. As we transition to like the DASH diet, it's very similar in the pattern of eating to the Mediterranean, but DASH actually stands for a dietary approach to stop hypertension. Hypertension means high blood pressure. So it's a diet approach to help control your blood pressure. So it focuses also on sodium reduction to 1,500 milligrams per day. So from the 2,300, that's the average American sodium recommendation, down to 1,500 milligrams per day. And last but not least, flexitarian, which is maybe a new term for a lot of people, and it's not that as popular or wide known, but what the word flexitarian means is flexible plus vegetarian. So it doesn't mean you have to commit to being a vegetarian, although we know the benefits of following a plant-based diet that can look differently. So Mediterranean diet can also be a plant-based diet. But if you're following a flexitarian way of eating, you're choosing more plant-based foods and still receiving those health benefits, but you can still have occasional animal products or animal protein.
Now we just have a few minutes left, so I do want to remind our viewers you can call in if you have any questions. That number is 855-796-4475. We'd love to hear from you. Now, how important are lifestyle choices like diet and exercise in terms of maintaining those results from surgery?
Absolutely. So I can't reiterate how important it is to understand that plastic surgery is not a substitute for a healthy lifestyle, a good diet, exercise program. It is there to enhance those things. So plastic surgery will enhance a good lifestyle, and a good lifestyle will enhance the results of plastic surgery. So they really are, go hand in hand. So the ideal patients for body contouring procedures are fairly close to their ideal body weight. And I do have a weight loss program in office because I do get a lot of patients that are significantly overweight, and they come in thinking that I can do something that will get them to a healthy weight and to what they see themselves as far as their body. And I explain to them that they need to be part of this as well. So diet and exercise, I can't stress the importance of it, just from, of course, overall health.
And it's not a substitute.
Absolutely not. But it will improve the results of what I can deliver. Mm-hmm. So for instance, on a tummy tuck, I cannot do anything about the intra-abdominal fat. The intra-abdominal fat is also sometimes known as visceral fat.
Right.
That's the fat that lives on the inside of your muscles, and that's around your organs, your stomach, your liver, your kidneys, the fat that lives on the inside. There's absolutely nothing that I can do for that because you can't touch that.
Right.
The only way to lose that is through diet and exercise. So by dieting, exercising, getting to your ideal body weight, you're going to reduce that intra-abdominal fat so that when I come back and tighten those muscles, I can really leave you flat. And the analogy I give my patients is that when you're packing a suitcase, you've packed so much clothes, and you're going to get it closed one way or the other. You're going to have somebody sit on it, you're going to zipper it down, and you'll get it closed, but it isn't going to be flat. It's still going to be bulging. So now you open it up, you take out a couple of outfits, and you're able to close it, and it's nice and flat. And I have the same issue when I'm doing a tummy tuck. If somebody has a lot of intra-abdominal fat, I'm really fighting against that fat to try and get them flat.
Now, you talked about weight. Now, also one of the things you mentioned earlier was maybe smoking. Now, smoking, that's a big red flag when it comes to someone wanting to do a procedure. Is this true?
Smoking is a huge red flag. There, you really should not do any sort of elective plastic surgery on a smoker.
Why?
Because the risks of having a wound healing complication are astronomically high, specifically for tummy tucks, breast lifts, breast reductions, facelifts. Any operation that I'm moving around large areas of skin can basically have the skin die. So when you're moving large areas of skin, I am dividing, hundreds of little blood vessels that are there to keep that skin nourished with blood while it's healing. And I'm relying on very small blood vessels to keep that skin alive. And smoking and, of course, nicotine caused your blood vessels to constrict. Nicotine is a vasoconstrictor, so it causes your blood vessels to clamp down. And also, smoking over many years damages blood vessels, and that's the reason why it causes heart attacks, strokes, vascular disease. It's all tied to the same fundamental problem of smoking and nicotine, which is damage to blood vessels. So if you do a tummy tuck on a smoker, somebody that's been smoking for 20 or 30 years, the blood vessels are not going to be healthy enough to keep that skin alive. And you can get what's called a necrosis. A necrosis is basically death of any tissue, in this case, it's skin. So it can really deform the area that you're working on. It can absolutely deform the abdomen, it can deform the breast, it can deform the face. So my recommendations for smokers are dependent on how long they've been smoking and how much they've been smoking and what procedure I am doing. But it can be anywhere from 1 to 6 months that I make them quit for, and I will test them, because I know
they can't hide it from the doctor.
I know it's it's obviously very difficult to quit smoking.
Absolutely.
And patients really struggle with it, but I need to know that they're committed to it. So there's actually a urine test, and we check it, and if I feel that somebody has not really been able to get to the point where they need to be off of all nicotine products.
We have 30 seconds, doctor, and I want you to give our viewers any last-minute feedback or advice when picking a plastic surgeon.
So like we talked about, the most important things are board certification, licensure. So the American Board of Plastic Surgery is a good place to start. The American Society of Plastic Surgeons, the Florida Department of Health. I want to make sure that obviously that your doctor is really a doctor.
Absolutely.
And then look at before and afters, talk to other patients, and get the overall trend of reviews. And that'll get you comfort at home, and then come in for your consultation and decide if you're comfortable with that doctor to do your procedure.
And I like the idea of talking to other patients who have visited the same doctor. That's great feedback as well. Thank you so much, Dr. Careaga, for being here. What a great show. That does it for us this hour. Be sure to join us next time on the Health Channel. All Health All the Time on South Florida PBS. Follow us on Facebook, Instagram, Twitter at All Health TV. And please be sure to visit our website, allhealthtv.com, where you can watch a Health Channel live stream and watch videos from previous episodes. I'm Kathy Buccio. I'll see you next time.